There are different approaches to dealing with a retro-displaced or a receding chin. There's a whole world of implants, and then there's a whole world of using your own bone to be able to reshape your chin, to give it more projection, to give you a better profile, and to give you better proportionality to your face. Each of those approaches, the implant approach versus what we call sliding genioplasty, has its own advantages and its own disadvantages. And the decision as to what is best for you as the patient really comes down to a number of factors and can only really be accurately determined during the consultation. In general, the advantage of a sliding genioplasty is twofold. One, it's your own tissues, and when a sliding genioplasty is done, I'll just explain to you how that's done. This is a model of the skull. The bone, the jawbone, is cut along this line that you can see in the white, and the chin is actually slid forward, and there has to be bone-to-bone contact in order for it to heal, and that's exactly what happens. It heals like a fracture. We use little plates and screws to hold it in position, and within about 6 weeks it's healed. That gives you a number of advantages. One is that it has resilience. So if you're young, you're active, you play sports, you play contact sports in particular, your chin is essentially, for the most part, as strong as it ever was once you're healed. And you have no foreign material except for the plates and screws, which are very small and rarely have to come out. So that's a big advantage. The other thing that I personally feel is the advantage is it pulls all of the soft tissues along with it. So it gives the muscles and the fat and the sinew that's in the area of the neck a tightening by pulling it forward. So it gives a very nice tightening of the neckline. And in fact, it gives a bit of a rejuvenation effect as a result of that. Those are just some of the advantages. It's also a reshaping of the chin rather than an adding of more volume. So in certain circumstances, like a young female for instance, she may not want to have more bulk of a chin. If you're a young male, on the other hand, you may want a little more bulk, and there's a way of doing a sliding genioplasty to add the appearance of more bulk as well. And there's a lot of technical details to that, which is sort of beyond the scope, I think, of this talk. So that's a sliding genioplasty. The risks of a sliding genioplasty are not high. Neither are the risks of an implant genioplasty or what we call an augmentation genioplasty. But all surgery has risks, potential risks. And the decision for you to go ahead with surgery or not to go ahead with surgery really just is a balance between the benefits that you'll get from the surgery versus those risks. In the case of a sliding genioplasty, the risks are bleeding and infection, like any surgery, and also a risk to this nerve. You can see the little holes in here on either side. On the model, that's where a nerve comes out to give you sensation, feeling in your lower lip and chin. And there's a risk of injuring that nerve, the consequence of which would be numbness of your lower lip, as though you were permanently going to the dentist and you had your lip frozen for that length of time. The chance of that happening is very, very small, less than 1% with the sliding genioplasty. And that's probably the worst complication for that operation.